2822 News presents Newsmakers with your hosts Jane Ann Bugda and Andy Mahalchik.
Hello and welcome to Newsmakers. I'm Andy Mahalchik.
And I'm Jane Ann Bugda. Today we are talking about a topic that touches many of our lives, cancer. But in our area, we are lucky to have the Northeast Region Cancer Institute in our corner.
We are joined today by team members from the Cancer Institute to talk about cancer in our region and how they continue to provide studies, support, and resources to our region. Up next, meet our guests.
And our conversation begins when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. And it's been some time since we had the Northeast Regional Cancer Institute panel on to talk to us. And Andy and I have been doing this show for almost 25 years. They've joined us many times, but it's time we have them back to see what's new and what's going on in their programs and how they study cancer in our region. So Andy and I are happy to have you here.
You know, and hopefully our goal is one day we don't have to have shows like this. That we could say, remember when cancer was a concern, but you know, realistically, real life is it's here probably for a long time to come. But and your organization is doing great work to help our community.
And we are joined today by Karen Saunders, who is the president of the Northeast Regional Cancer Institute, Laura Toole, who's the executive vice president, and Karen Rechak, who is the Vice President of Program and Surveillance. And we want to thank you all for being with us today because this is an important topic, and I think that we want to reacquaint our viewers about all the important things that you do. So let's take us back for a brief history, take us back to the beginning. How did it all begin?
Well, I'll take this one. Thank you for having us. Yes, it's been some time since we're here, but we really appreciate the opportunity to talk about the organization. We've been in existence for over 30 years, and sometimes we feel like we're a well-kept secret. Oftentimes with resources, you don't know about them until you really need them. So the Cancer Institute actually officially began in 1991. It was 3 years in the planning. It was visionaries in our community who wanted to provide health care on that community level. They wanted the hospitals and physicians to work together to provide resources to the community. So it started in 1991. It started with 2 employees.
Wow, and what are we up to now?
19.
Wow, well, that's good.
Right.
And you could probably use 38.
That's right. That's right.
So how has the Institute grown or changed over the years?
Well, as I said, certainly in size and in the number of programs that we have to offer. I know we're going to get into some of the services that we provide, and we'd like to talk about those in some more detail. But the outreach in the community is the same. Our mission is the same. The services and the number of people that we reach out to has grown over the years, though.
And right from the start, you know, people hear the word cancer. It's no longer a death sentence, but it's a scary word for sure. What are we seeing as far as the need for your services or the number of, I'm not saying cancer patients per se, cancer survivors, but what are we seeing as far as the need for what you do?
Well, cancer survivors have grown every year. Each year we're making strides, and when I say we, I mean, you know, researchers across the globe are making strides in cancer treatment. So people are living longer. So it has become more of a chronic disease, if you will, in a lot of cases. So we see that happening, and what we can do on our end is help people through those times when they're getting treatment, when they're first diagnosed, and those late years afterwards where they might have side effects that continue to go on. So we're able to educate people about those, what might happen, what they can expect, and we help them get through that.
And isn't it true that it may not be curable per se? It is many times if it's caught in whatever form is early enough, but it's treatable and people can live with it.
Yeah, and that's key, Andy, is finding this disease early. And we'll talk more about that as we go forward, but finding it early when treatment is more effective is important.
You know, how unique is the Cancer Institute for our area or for the state?
We are very unique. I don't think there is another organization exactly like the Northeast Regional Cancer Institute. As I said, the visionaries that started the organization Even at that time, and as you know now, healthcare has become a little bit even more complicated than it was over 30 years ago. The vision was that the enemy was cancer, not the various hospitals and physician groups. The idea that everyone would work together to combat the disease was the idea. So it was quite a meaningful organization then, and continues to this day to be that.
And we're also unique in that we work across, because we're independent, we're not a national organization, we're a regional organization, and we work across all health systems and providers. And I think that's really one of the important ways that we serve our community. So you don't have to be attached with any particular healthcare provider. We'll take you regardless of who is providing your services, and can help you navigate that, whether it's talking about screening or, as Karen said, through newly diagnosed, through treatment, through follow-up, and through survivorship.
And this is where communication has to be key, because I think you have so many different healthcare providers and different individual physicians who may or may not be members of certain providers. So people, I'm sure, have lots of questions and say, where do I go from here? Can you help guide them along with that?
Absolutely. We often get people who are just diagnosed, or their caregivers, who say, I've just learned that I have cancer, and that's pretty much often the last thing they hear in that particular appointment is, I have cancer, and does that mean I'm going to die? Happily, that's not the case for most individuals these days. As Karen said, early detection is key, and then we can really help provide information and help them work better with their healthcare or treatment team to know what to expect for the future in both the short term and long term. And that's really initially what people want to know. They want to know, what can I expect? What should the timing be? We can provide them with actual factual information, but also help coach them in terms of what should I be asking my treatment team, and what resources are available both regionally and nationally in terms of getting through a cancer diagnosis and treatment through follow-up.
So anyone can use your services within the region. So I mean, you just give you a call and say, I need help, and where do I go now?
And I think that's the nice thing about us as well, that because we are small, when you call us, you get a real person. If you call during normal business hours, if you leave a message, we will call you within the next 24 hours. So it's not a big sort of conglomerate where it can be really complicated for people to access an individual that has the expertise that can help them.
And I would think also there's so many, with the internet, of course, Google this, Google that, Bing this, do that, whatever. So how do you sort through all the white noise to, of course, your doctor, primary care, and your oncologist and stuff help guide you, but I still think also you're not with them every single day. And you still, even when you leave the office, you have so many questions, but that's where your services can come in handy, like, sift through that noise and sift through the information. Don't do too much research, because the doctor will tell you that it may or not pertain to you.
And that's part of the mission, is to navigate. So our logo is a compass. We'll help point you in the right direction. So that's what we really like to do, is as Laura said, coach individuals, and maybe take it a piece at a time, and call us back tomorrow and let us know how you made out. Were you able to make that contact that we gave you? And if not, we can find something else. So we really coach them and navigate them through this whole diagnosis. And it starts with screening. That's a big part of what we do, is our community-based cancer screening navigation program that gets people screened for breast, cervical, colon, and lung cancer, because we know if you adhere to those screenings, we can reduce your risk of dying from that cancer. So that's an important part of what we do.
Are men still the worst patients? And I say that facetiously, but are men the last ones to get checked out, or they, for whatever reason, I'm going to say fear, but they don't think about it as much?
I think what happens a lot of times is that it's not, in the front of their mind to do these kinds of things, preventative. But that's true for a lot of people. The old, if it's not broke, why fix it? But that's so not true when it comes to cancer. We really need to look before you have any symptoms of the disease. That's when we can find it early, sometimes even prevent the cancer from occurring. For example, in colon, when you have a colonoscopy and they remove a polyp with malignant potential, technically we've prevented a cancer from occurring. So it's really important to look before you have symptoms.
What is the most commonly diagnosed cancer in our region, in Northeast PA?
In Northeast PA, lung cancer is
Really?
the most commonly diagnosed cancer, yes. When we look at men and women combined, certainly next is breast in women, and then men, prostate, and colon cancer is fourth.
Oh wow, that surprises me because
Right.
I wouldn't have thought lung cancer. But you know, one of the programs that you have is the cancer registry, and you know, it fascinates me because you've been doing this for some time now. So why is it important? Who provides the information and the data? What is it?
Well, cancer is a reportable disease to the state. So each hospital has to report to the Department of Health. So the Cancer Institute, and it's mentioned a regional cancer institute, and as Laura earlier said, we work with all the health systems. So what's unique about our registry is that that we do work with various health systems, and we collect the data and we report it to the state.
And over the years, we've done stories on concerns of cancer clusters. Years ago, we did a bunch of investigative reporting in Pittston, some other places in Luzerne County, and we were involved. I believe your organization, we had a big town meeting up in Pittston, and that registry played an important role. I believe it was the CDC came in and said, based on this registry, we don't have a cancer cluster here.
Correct.
You
Yeah.
know.
Yeah, we collect those data and submit them to the state, and the state's Department of Health epidemiologists are the ones that, you know, look at those data and decide whether or not it meets the criteria for a true cluster.
Is that registry unique to our region, or do they have them in other parts of the state?
Well, the community-based registry is unique. The fact that the cancer registry, usually it's within each health system.
So it's, yeah, and you've been doing this for, I know you ladies have been there for some time, so you've been gathering this information for quite some time. So have you seen any certain trends that you notice with it, or that?
What we do each year is look at the cancer landscape here in NEPA relative to the U.S. Or in other words, does cancer affect our population the same as it affects the rest of the population? And we look for differences or disparities. And what we found over the years, that we do have higher incidence rates of some cancers. An example is lung cancer. We have about 30% more lung cancer here than we do in the U.S. So we as an organization then take that information, kind of like a needs assessment, and says, what does the population need here? So we know what the risk factors are for lung cancer. Smoking is number one, but certainly radon is another one. Environmental factors. What we do with that information is provide that information to the community, healthcare providers, the community at large, and instruct them on how to reduce their risk. If they're smokers, you know, tell them about the dangers of smoking. If they're ready to quit, give them tobacco cessation resources. If they, you know, live in an area where there may be radon, how to test, what to do if you have high radon. So that's the kind of education we do with the information that we gather.
And you mentioned radon. I remember doing lots of stories over the years, maybe 25, 30 years ago, where radon was the unseen factor. You know, you can't smell it, you can't taste it.
Exactly.
And now we're seeing a lot more proactive steps to address the concerns. Or if you're buying a house, you need now radon testing.
Exactly.
It's all part of the inspections. Years ago, it wasn't.
Right.
You know, back in the day, as they say. You know?
Yes.
Right. but
We were there back in the day.
Back in the day, but it's still something that we're talking about. So right.
Well, so I read about it.
So, and another one of your programs, of course, is the Cancer Patient Navigation Program. Now, what is the criteria for that program? That's another fascinating program.
So it is. It's one of the ways that we are what we call boots on the ground in terms of helping people. So through that program, we help people complete their cancer screening. So that's for the 4 cancers that were mentioned previously: breast, cervical, colon, and lung cancer. Now, the thing about lung cancer screening is that not everyone needs that screening. That's for a certain subpopulation of our residents that have a particular type of tobacco history, so we can talk about that as well. But through that program, we contact people again. We work with their primary care provider. We assess barriers. So some people, it's insurance, it's other financial concerns. It could be transportation. It could be things like lack of awareness. We talked about the importance of screening because many people are surprised cancer doesn't have any early warning signs, so you're not going to feel sick. That's why screening is so important. So don't wait until you feel bad to get your cancer screenings. And then we help those individuals actually complete their screenings throughout that process, make sure they get their results because that's important as well. And then again, remind them of our services. If next year or whenever their next screening is due, if they continue to need assistance, we can help with that.
And of course, this is all confidential because a lot of people are afraid, if word gets out that I have cancer or whatever, it's, I'm not going to say an embarrassment factor, but many people are private. So talk about the confidentiality of all this.
Right,
Because they see a group that's not really a medical group, but you work with medical professionals who are governed by certain rules and ethics, that kind of thing. Talk about how you make sure that if you call this group, that it's confidential.
Absolutely. We follow all of the HIPAA rules for confidentiality. We work with all of these partners across the region, and we have what's called a business associate agreement with them to say that we will protect this data the same way that you protect this data. And so all of our software is HIPAA compliant, so we make sure that all of that data is totally confidential and protected.
Now, is there any cost for services?
All of our services are free of charge, whether it's a program that we can come and do to your community group or to a school or to a company, and all of the services we offer with our cancer screening navigation program and all of the other ways that we help individuals that are affected by cancer is free of charge.
Well, we are going to take a quick break, and when we come back, we're going to continue our conversation with our guest from the Northeast Regional Cancer Institute. You can find information on today's program on 2822news.com. And you're watching Newsmakers. We are a proud recipient of several Pennsylvania Association of Broadcasting Awards and Keystone Media Awards, and we'll be back right after this.
Welcome back to Newsmakers. Andy Mahalish along with Jane Ann Bugda. We are talking to folks from the Northeast Regional Cancer Institute. Karen Saunders, the president. Karen Recheck, did I get it right? She's the vice president of programs and surveillance. And Laura Toole, the executive vice president of the Northeast Regional Cancer Institute. Let's face it, we all hear the word cancer, or we've heard of it, or virtually every family's dealt with it one way or another. I don't think, and if you haven't, God love you, God, that's great. But at one time or another, we've either had friends or family who have had to deal with cancer, and this organization helps those families or individuals navigate through it and helps help them through the journey.
So tell us a little bit about the navigation, leading up to the navigation program. So tell us a little bit about that, what it encompasses.
Well, we're not a treatment facility, so we're not doing the actual screenings, but what we do is we work directly with patients and with their healthcare providers to make sure that they're up to date with the recommended screenings. And those recommendations are really set by national guidelines. So for example, for colon cancer, it's important to, if you're 45, to start your colon cancer screenings. It's also important to let your healthcare provider know what your personal and family history is. Those screening recommendations can be tailored based on your personal and family history, but we help people that may have barriers to screening, and some people automatically think, well, for people without insurance, that's one barrier to screening, but it's not the only barrier. So our navigators help assess all of the barriers that may exist that prevent people from getting screened. Sometimes it's as simple as I didn't know it was important or why it was important. And then we can help remove those barriers through a multi-step process and help them get to their completed screening. That's the goal. That's our definition of success. You've completed your cancer screening and you've gotten your result.
And how important is support for survivors and family members? How do you help them? You know, because when someone's going through something, you need support. And talk a little bit about that, the support you offer.
Through our what we call our information and referral services, we help individuals who are affected by cancer, their family, and even their healthcare providers at times to find out what the next step might be. Sometimes we get a call from the community that says, I was just diagnosed with breast cancer. I don't know what the first thing to do is. So we help individuals, take apart that, piece by piece and help them, get through one step at a time and understand what they need to do next. They also want to know what resources are available. Sometimes, they're not going to be able to work now. So I'm not going to have an income. How am I going to pay my mortgage? How am I going to keep my car? Things of that nature. We don't provide all of those resources directly, but we keep a log of what's available, and we connect people to the resources that they may need. So that's key in when they're trying to make their treatment appointments and, live, if you will, we can help ease the burden a little bit by providing these resources.
Make it less overwhelming.
And your website has a wealth of information. You have a very active Facebook page, and we're showing some of the pictures of your group in action. And everything comes with a cost. So how are you funded? What do you look for in funding?
Certainly. Well, we were first talking about the registry. That is a shared fee for service. So a portion of how we're funded is through the registry. And we also do receive some funding from the Department of Health. So we do get some state funding. But a good portion is grants and community fundraising. So all of those things are very important, and all of them are kind of up in the air.
Right, sure.
Every year it does seem like. So with the state budget not passing and various other things that are going on in the area, yes, it's always a little up in the air.
But you also have a big celebration that you have, and it's called the Spirit of Hope.
Yes.
And tell us a little bit about that.
We are so blessed with wonderful volunteers. And the Spirit of Hope celebration, this will be the 13th year that a group of volunteers, individuals, businessmen, business leaders in our community come together to now we're showing the honoree of the event this year. Yes, the honoree is John Baum. And
John's a good friend of ours. He works with our veterans youth team. So
yes,
we've done many stories with him. He's a Top Gun.
Right.
Thunderbird pilot.
Yeah.
That's right. Well, in addition to that, he's a philanthropist. So that's one of the many qualities that he's going to receive the Tribute to Courage. So he has exemplified courage in a lot of different ways, but also in helping others that are less fortunate. He, joined the U.S. Air Force at 17, went to the Top Gun school, and even instructed there.
So, and we have information on our website about getting tickets to the event, and more about John and more about your organization. I do want to ask, if someone's out there watching this program and they're a group or an organization and they want to learn more, what can they do to have you come to their group to speak to them?
They can visit our website and communicate with us through that portal, or they can call us at 570-904.
That has our numbers up. He'll be putting them up.
Okay,
Yes.
904-8808.
And you talk to all groups all across. Is there any certain area that you cover, or is it all throughout northeastern Pennsylvania?
We have an official footprint, but anybody that calls the Cancer Institute, we'll talk to you. Yes.
You're talking about the phone number. We all push the name. You have to think, what is my number?
What is our
That's
number?
right.
Yes.
That's and what do you want to
That's
say? We were talking about groups, but I'm sure there are families out there, people who know those who may have just been diagnosed with some form of cancer. It's a scary thing. The word itself is scary. We're not going to sugarcoat it. But what do you want to say to those families out there? What can they do? They're calling their doctors. They may be involved with their healthcare provider. What do you want to tell them to urge? How can you help them out? What should they do? What's the first step they should do?
I think we want to always emphasize that there is hope, that there is always hope, and that there are people like this organization that is there to connect you to resources, but also to listen to you, because a lot of times that's what people, it's overwhelming when they hear a cancer diagnosis, that we can connect you to resources, and we have the time to listen to you, to understand what you need, because every individual is different, and to help you through this experience, and that there are a lot of people on the other side of this that are waiting to help you as well.
And that's a key. Everybody, every case is different.
Yes.
Absolutely.
Again, don't look at the internet and say, that's where I fall. You do not know. And
Right.
you have your own journey.
And it's good that there are people here in our community that can guide you through this, because like you said, there's a lot of information on the internet. A lot of times that's not true. So it's good to have a nice support staff in all of you for people out there that are looking, Is there anything that you want, a program that we're about a minute and a half left, a program that you would like to have
A wish
that
list,
a
per se.
wish list or something that you'd like to have, something more for your program? Is there anything out there that you're looking towards or would like?
I think I feel like we help a lot of people on an annual basis. That navigation screening program, since it began in 2012, we've helped people complete over 13,000 cancer screenings, but with additional resources supporting the Spirit of Hope or just donating to an entity like ours, the more resources we have in that regard, the more individuals that we can help. If you have cancer, connect you to resources. If you don't and you're not up to date with your screenings, we can help you figure out which ones are important for you and help you to complete those.
So you're not alone out there.
And we just had a big wish fulfilled, like you were talking about, in terms of the navigation program. Through a grant, we received funding to assist not only English-speaking patients, but we will be rolling out the navigation program for Spanish-speaking
And that's important now
patients.
as the face of
and
our
then
community.
eventually other languages as well. So this has been on our list for a very long time, and we'll be rolling it out very soon.
Well, Karen, Laura, and Karen, we want to thank you for joining us today on Newsmakers. For information on today's program, you can find it on 2822news.com. For Andy Mahalchik and everyone behind the scenes, I'm Jane Ann Bugda. We thank you for making Newsmakers part of your day, and we'll talk again next time.